Well, I'll get started with the topic because I have a lot of information that I would like to show you. So first, I'm going to describe what is the gut microbiota. Then we will talk a little bit about the connection between the gut microbiota and obesity. And we will follow up with different ways that we can modulate the gut microbiota through birth mode, diet, exercise, fecal microbial transplants, and bariatric surgeries. So first of all, what is the gut microbiota? The gut microbiota is formed by bacteria, viruses, fungi, and archaea. For the purpose of this presentation, we are mainly going to focus on bacteria. Now, the number of bacteria cells we have in the human body, not just the GI tract, but the human body is 3.8 by 10 to the trillion, which is about the same number of cells, of human cells. They are about the same order. However, the reason why we're not aware that we have this amount of bacteria in our body is because their mass is significantly smaller in comparison to the rest of the human cells. So as you can see here, this part here in red represents the mass of erythrocytes, adipocytes, and muscle cells. Whereas over here we have the mass of bacteria, 0.2 kilograms for an average human of 70 kilos. Now, what are the functions of the gut microbiota? Well, it has so many functions. One of them is the degradation of complex carbohydrates that human enzymes cannot fully digest. And in doing so, they produce short-chain fatty acids, such as propionate, butyrate, acetate. And short-chain fatty acids are going to have so many beneficial effects. For example, particularly butyrate is the main source of energy for colonocytes, the cells in our large intestine, the colon. But they also help to organize tight junction proteins, which are proteins that pretty much help to keep together the colonocytes to prevent the bacterial translocation from the intestinal lumen into our system. Short-chain fatty acids also stimulate mucin production, and mucin is a glycoprotein that forms the mucus. It's a second layer of protection. So basically we have the epithelial barrier and then we have a mucus layer, and both of them are going to protect us from bacterial translocation into our circulation. Short-chain fatty acids also help to stimulate satiety hormones such as GLP-1, PYY, and they have anti-inflammatory properties. Another function of the gut microbiota is to help us harvest more energy. And it produces vitamins that otherwise we wouldn't be able to produce, like vitamin K and several of the vitamins B. Now, we previously knew that the gut microbiota can cause different diseases, such as, for example, Clostridium Diffusi or the Helicobacter pylori. However, we are now able to understand that there are so many other diseases that we previously didn't recognize had a microbial component, such as, for example, irritable bowel syndrome, inflammatory bowel disease, obesity, diabetes, autoimmune diseases such as lupus or rheumatoid arthritis, certain types of cancer, and even psychological behaviors such as anxiety and depression, which is something that we found in my doctoral dissertation. Now, talking a little bit about the relationship between the gut microbiota and obesity, I'm going to show you this study that caught my attention into this field. And that's a study published by Turnbaugh in 2006. And basically they did fecal microbial transplant from an obesity model into a germ-free mice. And so the obesity model is the OB mice, which is a mice model that has a mutation in the OB gene. And so they don't produce leptin, and they have hyperphagia and also a decreased resting metabolic rate. So they develop obesity pretty early in their lives. And what scientists observed is that when they performed the fecal transplant from this model into the germ-free mice started gaining weight without a significant increase in the energy intake. And that is the interesting part, is my point of view, because it's not that they were eating more, they simply were gaining weight potentially because the microbiota was able to harvest more energy from the same food they were eating. Now, germ-free mice are mice who are separated since the moment they are born, and they are put into individual cages. They are technically free, considered to be free of bacteria, and they are used very common in this type of research called microbiome research. Now, with regards to humans, we know that if we compare the gut microbiome of patients with obesity versus lean individuals, there's a significant difference in microbial composition. For example, in lean individuals, we have higher concentration of the genera Akkermansia, Bifidobacterium, Fecalobacterium, Lactobacillus, and these genera have shown to be related with positive health outcomes. However, this type of data only shows a relationship. It doesn't really show a cause effect. It is not telling us that because they have these bacteria, they end up being lean or developing obesity. So what scientists have done is to perform fecal transplants from these patients into germ-free mice to see if the mice decrease weight, maintain their weight, or increase weight. And that's exactly what they did in this study, which is a very elegant study in my point of view. They recruited four twin pairs, only 4 twin pairs. But the interesting part is that one of the twins had obesity and the other one didn't have obesity. And so they collected fecal samples from each of these twins, and they inoculated 3 to 4 mice per twin. And what they observed, this is how the germ-free mice are caged. And what they observed is that the mice developed the same microbial composition of their respective donor. Now, the interesting part is that the mice who received the fecal transplant from the lean twin, they had the expected weight gain. However, the mice who received the fecal transplant from the twin with obesity had higher visceral and body fat without a higher energy intake. And this to me seems to be unfair because you're basically eating the same, but you're storing more fat. And in the second part of this same study, what the scientists did is they co-caged the mice that received the fecal samples from each of the twins. And what they observed is a protection in the mice who received the fecal sample from the twin with obesity. In other words, they had lower increment in body fat. And this could be, the hypothesis is that this could be because mice are coprophagic. In other words, they eat each other's feces. And so in doing so, they got contaminated by the microbiota of the mice who received the samples from the lean twin. So taken together, these results demonstrate some sort of a cause-effect relationship between the gut microbiota and obesity. And there are several hypotheses that have been proposed as to how is it that the gut microbiota can actually affect body composition. One of them is through energy extraction, because the gut microbiota is able to ferment indigestible fibers. Also because it causes metabolic endotoxemia, it increases intestinal permeability. Well, not increases, it controls intestinal permeability, lipopolysaccharide translocation, intestinal and systemic inflammation. And it also produces metabolites such as short-chain fatty acids, which we already talked about. They regulate the delivery of satiety hormones, but also neurotransmitters such as serotonin and GABA. And as I will show you in another study here in a little bit, the gut microbiota also seems to regulate the resting metabolic rate. Now, how is it that we can modulate the gut microbiota? Well, there are so many factors. Pretty much anything you can think of is going to affect the gut microbiota. And that's why it's so difficult to do research in this field, because you have to control for so many things in order to decrease confounding effects. So the birth canal, exercise, diet, fecal microbial transplants, bariatric surgeries, antibiotics. We saw that sleep also seems to affect the gut microbiome. So there are so many factors that can play a role in regulating bacterial composition. So we're just going to talk about some of them quite briefly because of the time constraint. So with regards to the birth mode, we know that when we are born, we have a sterile GI tract. And that GI tract is going to be colonized with bacteria from our moms. And if that bacteria composition is going to depend whether we were born vaginally or through C-section. So if we are born vaginally, we're going to have our mom's vaginal and intestinal bacteria, which is a good thing because we are naturally supposed to have that bacteria. Now, if we are born through C-section, at most, we're going to end up having our mom's skin bacteria. And babies who are born through C-section, they have about 35% higher risk of obesity, 30% higher risk of respiratory tract infections, 23% higher risk of asthma in comparison to babies who are born vaginally. Now, there are good news for moms who don't want to have their babies vaginally, and that is this pilot study. It still has to be replicated in a larger scale, but this pilot study was just published this past year, 2020. Basically, it shows that when babies are born vaginally, they have high concentration of Bacteroides bifidobacteria. When babies are born through C-section, they have higher concentration of pathobionts and Clostridium. Now, the other option or the treatment that they are trying to develop is basically they collected a fecal sample from the mom a couple of weeks before delivery, and then they took 3.5 grams of this fecal sample. They dissolved it with 5 milliliters of breast milk, and they provided this milk to the baby in the first meal the baby had, basically. And that was enough in order to change the gut microbiome of this baby who was born through C-section into a similar microbial composition of the baby who was born vaginally. So that might be, it sounds quite gross, but you know, maybe we can refine this technique with, I don't know, some sort of pills or something like that. And that might be enough to circumvent this, you know, having to go through a C-section if that's not what the mom or the gynecologist would recommend. Now, we know that the establishment of the gut microbiota is taking place in the first 3 years of life. So the gut microbiota in the first 3 years of life is gonna pretty much gonna dictate the gut microbial composition or the core of your gut microbial composition the rest of your life. Now, if you provide antibiotics during these 3 first years of age, seems to be quite detrimental for the baby. So we know that, for example, children of moms with normal BMIs who consume antibiotics during the first 6 months of life, they have an increased risk to become overweight at 7 years of age. And we already knew this, but the interesting part is the second part of the study. We show that children of moms with high BMI who consume antibiotics during the first 6 months of life had decreased risk to become overweight at 7 years. In other words, consuming antibiotics was basically causing a reset in the gut microbiome of the baby. If the baby had a healthy gut microbiome because their moms had normal BMI, then they were going to be affected. They were going to have a higher risk to develop obesity. However, if the baby had an unhealthy gut microbiome because their moms had high BMI, maybe that could help them to decrease the risk to become overweight at 7 years. Now, with regards to diet, we know that the most important thing we need to do in regards to diet is to consume enough fiber and enough prebiotics, for example, inulin, oligofructose, fructooligosaccharides, which have shown to decrease appetite, improve gut barrier function, decrease systemic inflammation, improve weight loss, and it does so by acting through the gut microbiome. Now, we were listening in the first presentation about omega-3. Omega-3 also seems to be quite good in protecting the gut microbiome. So in this animal study, basically, they provided a high-fat diet for 12 weeks to mice. And in the control group, we can see here that the mice who consumed the high-fat diet doubled the body weight of the control group. However, if the mice were consuming the same diet, but supplemented with omega-3, they provided fish oil and krill oil, they experienced lower weight gain, lower cholesterol, triglycerides, and LDL. And the interesting part with regards to this presentation is that the gut microbiome was protected. So there might, you know, the omega-3 might be acting through the gut microbiome in protecting mice from the effects of the high-fat diet. Now, in this other animal study, and the reason why I'm showing you this many animal studies is because it is easier with regards to gut microbiome, because there are so many variables that are difficult to control in humans. It is just easier to first perform these experiments in animals and then try to replicate them in humans. So in this study, they divided the groups, the animals, in 4 groups. So the control group, which consumed a libitum diet. So they had the freedom to eat as much food as they wanted. And every other group also, in the first 2 weeks, they had a libitum diet. However, the second group, starting at 2 weeks, they were given antibiotics. The third group, they were given a caloric restriction. They were consuming 70% of the calories consumed by the control group. The fourth group was consuming basically a combination of the caloric restriction diet and the antibiotic. And to our surprise, the scientists observed that the antibiotic, regardless of whether or not the mice were in a caloric restricted diet, increased the body weight. So for example, here we can see here in black, that is the control group. And then in red, we have the antibiotic group. So just by giving them the antibiotic, mice increase their body weight. Now, in color orange, we have here the caloric restricted diet group, and they decrease the weight as expected. However, the same calories were provided to this group, and they had significantly higher weights because they were consuming antibiotics. And the negative aspect of this is that it was not a healthy body weight gain, because it was mainly formed by fat, as both groups that were receiving the antibiotics, regardless of whether they were in a caloric restricted diet, had higher fat mass and lower lean mass. So one of the explanations of this increment in body weight is because they have higher energy intake. So as we can see, here's the control group, the antibiotic group. However, this increase in energy intake would not be able to explain the differences in the caloric restricted diet and the antibiotic plus caloric restricted diet, because they're consuming the same calories. So scientists went a little bit further, and they found out that the gut microbiome also seems to be modulating the resting metabolic rate. So here, for example, we have the control group, then the antibiotic. So just by consuming the antibiotic, the resting metabolic rate was decreased. The caloric restricted diet also caused a significant decrease in the resting metabolic rate, which we already knew. However, when you combine both of them, so antibiotics and a caloric restricted diet, the effect is even potentiated, and we have a more significant decrease in the resting metabolic rate. Not only that, but scientists somehow, I still can't figure out how they found out this, but the length of the small intestine was increased in both groups, in the antibiotic groups. And that basically means that they are going to have a higher capacity of absorption of energy. So it will be another potential explanation of their weight gain. Now, this study shows for the first time that part of the metabolic benefits of caloric restricted diets are provided by the gut microbiota. And also that it's necessary to have the gut microbiota to maintain a resting metabolic rate. Now, with regards to exercise increases alpha diversity. What is alpha diversity? Is the variety of bacteria we have in our gut. And basically what we know is that the higher, the better. So exercise also increases short-chain fatty acids, which we already talked about. They have very many beneficial effects. They lower lipopolysaccharides in blood. Lipopolysaccharides are pro-inflammatory molecules that are located in the membrane of gram-negative bacteria. And when they translocate from the intestinal lumen into our circulation, they have a pro-inflammatory effect. So they are basically endotoxins, and they are decreased by exercise. Now, exercise also is correlated with a higher concentration of these two positive bacterial species, Fecalobacterium prosnitzi and Akkermansia mucinifila, which, since my point of view, they are the probiotics of the future. I believe these two have the potential to be the probiotics of the future. Now, however, exercise-induced gut microbiota changes are reversed once the exercise training stops. And that's pretty much what happened with every beneficial effect of exercise. As soon as you stop training, the effects are reversed. Well, it seems that the effect of exercise on the gut microbiota is pretty much also reversed when you stop training. Also, it seems that the effects of exercise on the gut microbiota seem to be more pronounced in lean individuals. And this might just mean that we will need a higher volume or intensity of exercise in people with higher BMIs. And not every person is a responder to exercise when it comes to gut microbial changes. In other words, depending on the bacterial composition you have before you start the exercise program is going to dictate whether or not you respond to the exercise intervention. And lastly, prolonged intense exercise can increase gut barrier permeability and should be avoided. Because of the prolonged duration and the high intensity, this can cause dehydration and, of course, a quite pronounced blood redistribution to the working muscles. So this can end up causing ischemia in the GI tract, particularly the intestines. And there's a great publication, actually, from the ISSN in the topic, if you want to learn more about the effect of exercise on the gut microbiome. Now, with regards to fecal microbial transplants, this sounds a little bit gross, so I'm going to go ahead and explain to you what it actually means. So you take a fecal sample, you homogenize the fecal sample, you filter it, and then as it is, you will provide it through a tube. So for example, you will provide a nasogastric, so from the nose into the stomach, nasojejunal from the nose into the second portion of the small intestine, or in the opposite direction through colonoscopy. And the only medical condition, at least here in the United States, for which fecal microbial transplants are allowed is for treatment of Clostridium difficile. And it actually has a pretty high efficacy. So it eradicates Clostridium difficile infection by 85 to 90%. And usually these people, once they are recommended to have an FMT, is because they already went through several rounds of antibiotics and they were not able to eradicate. In other words, they had a Clostridium difficile infection that was resistant to antibiotics. So what do you need in order to be an FMT receptor? As I said, here in the United States, only people that have Clostridium difficile, or if you're in a clinical trial, because there are several clinical trials that are analyzing the effect of FMT in different diseases. So hopefully we'll know more about the effect of FMT in other diseases pretty soon. And also not immunocompromised, because there have been actually several cases of deaths of people who were immunocompromised and received an FMT, a fecal microbial transplant, and they end up dying because of this. Now, what do you need in order to be an FMT donor? Well, first of all, not having obesity, not having received antibiotics recently, not having traveling recently, not immune, metabolic, or infectious diseases, and you have to pass the bacteria, virus, and parasite testing. Now, with regards to bariatric surgery, which is actually a topic that I'm particularly interested, I'm going to show you first this animal study, and then we're going to switch a little bit into humans. So in this animal study, they perform RYGB. RYGB is a type of bariatric surgery, it's Roux-en-Y gastric bypass. So they performed this surgery, then 2 weeks of recovery, and then they provided a high-fat diet to mice. And the mice still experienced, despite the high-fat diet, they still experienced 20% weight loss. Now, the second group was a sham surgery, which is basically a placebo surgery in which they just open the animal, but they don't really do anything to the GI tract. And this animal also had a high-fat diet for the same duration. Now, the third group was weight match sham. And basically, this third group received the sham surgery, but they were consuming 75% of the calories consumed by the RYGB in order to ensure that they were pretty much decreasing the same amount of weight of the first group. Now, what they were able to observe is that the group that received the bariatric surgery had higher lean mass and lower fat mass in comparison to the other two groups. And this took place despite the fact that they were consuming as many calories as the sham group and significantly more calories than the weight match sham. So they were consuming more calories, yet they had a better body composition. And one of the potential explanations for this is because they basically were pooping the calories. So they literally were excreting the calories, which is, I mean, is quite an interesting treatment if you think about it, because you're not decreasing the amount of food you're consuming, you're just excreting more calories. Now, in the second part of this study, basically what scientists did is they wanted to see if the effects of bariatric surgeries can be transplanted into germ-free mice by performing a fecal microbial transplant. And so what the scientists observed is that when germ-free mice received the fecal transplant from the placebo surgery, there was no change in body weight, as expected. However, when the mice received the fecal transplant from the mice who have the bariatric surgery, they experienced about 5% of weight loss. So it's not 20% as the mice who actually had the bariatric surgery, but it's still 5% without having had the surgery. It seems pretty decent. Now, this experiment was also run with humans. So basically, fecal samples were collected from patients with obesity and patients who just had a bariatric surgery, and mice were inoculated with these samples. And what we observe is that mice who received the samples from patients who had obesity, developed obesity, those who received samples from patients who just had a bariatric surgery decreased the body fat mass. And particularly in this type of surgery, they also increase the lean mass. So some of the considerations, this is a review that I published with my PhD mentor, Dr. Lee Greathouse from Baylor. There are so many differences in the methodology of gut microbiome research that sometimes it's difficult to interpret the data, not only in the DNA extraction and data analysis and storage method and you know, there are so many differences in that, but also in inclusion criteria. So some studies consider whether or not the participants had taken antibiotics in the last couple of months or probiotics or diet, and some others totally ignore these variables that can create a confounding effect. So as I said, is research, gut microbiome research in humans is quite challenging. In this systematic review that we just published in 2020, we basically analyzed all the studies that have evaluated the effect of bariatric surgeries on the gut microbiome. And what we observed is that the changes were dependent on the type of surgery. In other words, if the patient had an Roux-en-Y gastric bypass, the effect was going to be different than patients that had a sleeve gastrectomy or gastric band or any other type of bariatric surgery. And overall, some of the consistent findings that we observed by doing this systematic review is that patients who have bariatric surgeries had a proliferation of Akkermansia mucinifila. Again, we see this bacteria species here. There was a reduction in bifidobacterium, and to our surprise, there's a positive correlation between bifidobacterium and several lactobacillus species with BMI, body weight, and fat mass. And this was found in several of the studies, and it was a consistent finding. And this is one of the reasons why I am not a big recommender of taking probiotics, unless you actually have a condition for which probiotics have shown to be beneficial. My recommendation is just consume enough fiber in your diet, and that should take care of your gut microbiome. But we are not yet in the phase where we can recommend consuming probiotics for weight loss. We are very far from that point. So some of the take-home messages is, if you're going to have babies, it will be ideal to consider choosing vaginal birth and breastfeeding. I didn't talk about breastfeeding because of time constraints, but it's also pretty beneficial for the gut microbiome. Also, eat a diet that is high in fiber, as I mentioned, higher in omega-3. So I also support the consumption of omega-3. Avoid the use of antibiotics unless really necessary, particularly in the kids under 3 years of age. Oh, and if you're going to consume antibiotics, take the antibiotics as prescribed by the doctor. If the doctor says 7 days and you start feeling better at 3 days, still take the 7 days, because that will help to prevent antibiotic resistance. Now, we have another reason why we need to exercise in order to have a healthy gut microbiome. And now we know that the effect of bariatric surgeries are not only because of restriction or because it affects the delivery of hunger satiety hormones, of biliary acids. Another effect of the bariatric surgeries now we understand is the effect on the gut microbiome. So please be careful with what you recommend with regards to probiotics. If you're going to recommend a probiotic, make sure that there's enough evidence to support its use in that specific disease. Corroborate that you are recommending this specific bacterial species used in the study at the concentration and the recommended duration. And that's all for me. So I don't know if there's time for questions or not, but